Yes, so I did the session on pitfalls in diagnosing bleeding disorders and laboratory assays of hemostasis. And it was really a very practical, interactive session going through cases that I've seen on call and in clinic, where I've needed to have a knowledge of the nuances of laboratory testing and when certain things may affect laboratory test results, to decide how to manage those patients. And I made the audience do some work and answer some questions, because I was at the end of Saturday when people are finding it harder to concentrate. We were really pleased to have this session allocated to the NIHR, and I co-chaired it along with Dr. Rakesh Popat, who's the lead for the Heme-Onc NIHR group. And we had a format where Dr. Vanessa Pausty from the Coordinating Centre first talked a bit about what the NIHR does and what supports it can give to haematologists who'd like to do research. Then we heard about studies that had been delivered by the NIHR that have changed practice. So one called FLIGHT, that looks at first-line management of ITP, and another looking at patients with myeloma. And that was really good to see how these things actually change practice and change what we're doing day to day. The last part was a panel discussion with the people who'd spoken, and also Professor Peter Collins, who is a former chair of the National Specialty Group. And that was led by HaemSTAR, the National Trainee Network, who asked the panel questions about what they wished they'd known about research. So that was very lighthearted and very engaging. And I feel like we could have gone on with that for a lot longer than we did. So it was a great session to have standing room only at the NIHR session on a Sunday afternoon.